Hello, and welcome to another episode of Health Talk 366, the podcast where we dive deep into the facts behind the symptoms, the science, and the solutions. I'm your host, and today we're tackling a critical, yet often overlooked topic in cardiovascular health: silent heart attacks, what you need to know. Now, when most people think of a heart attack, they imagine intense chest pain, shortness of breath, or someone clutching their chest dramatically. But what if I told you that not all heart attacks come with clear warning signs? What if I told you that you could have a heart attack and not even know it? That's right. These are called silent heart attacks, and they're far more common than you might think. Over the course of this podcast, we're going to explore what silent heart attacks are, why they happen, how to recognize the subtle signs, who's at risk, how they're diagnosed, and most importantly, how you can protect yourself and those you love. A silent heart attack, medically known as a silent myocardial infarction, occurs when blood flow to part of the heart muscle is blocked, just like in a typical heart attack, but the symptoms are so mild or unusual that they go unnoticed or are attributed to something else. Some people might feel slight discomfort, fatigue, or even indigestion, but never suspect a life-threatening event is unfolding. Let's take a look at a real-life story. Survivor story: Maria's wake-up call. Maria, a 52-year-old schoolteacher, always thought she was healthy. She had never smoked, exercised regularly, and kept a balanced diet. But one day, she felt unusually tired and nauseous after walking her dog. She assumed it was just the heat or a mild stomach bug. A few weeks later, during a routine checkup, her doctor noticed abnormalities in her EKG. Further testing revealed she had suffered a heart attack without ever realizing it. "I was in shock," Maria said. "I thought I had the flu. I never imagined my heart was in trouble." Maria's story is not unique. Silent heart attacks account for nearly 1 in 5 heart attacks, and they can be just as deadly if not caught and treated. Jack, the long-haul trucker. Jack, a 58-year-old long-haul truck driver from Texas, was used to grueling hours behind the wheel. One day, he noticed a strange sensation in his left shoulder and jaw, along with some dizziness. He chalked it up to fatigue and poor sleep. It wasn't until a DOT-required medical check months later that doctors discovered heart damage consistent with a prior heart attack. "I didn't have time to go to the hospital. I thought it was just stress. If they hadn't caught it, I might not be here today," Jack recalls. His experience underscores the risk of misattributing symptoms, especially in high-stress, sedentary professions. Sray Nyang's silent episode. Sray Nyang, a 66-year-old Cambodian grandmother with a long history of type 2 diabetes, believed the tightness in her chest and lightheadedness one night was just her blood sugar acting up. But a week later, her shortness of breath worsened. At the hospital, doctors found her cardiac enzymes elevated. She had experienced a silent heart attack. "I always worried about my sugar and feet, never my heart. I didn't know diabetes could hide heart attacks like this." Sray Nyang's case reflects how chronic illness like diabetes can mask or blunt the usual symptoms of cardiac events. Leo's anxiety or heart attack. Leo, a 34-year-old IT technician, had been experiencing episodes of nausea, fatigue, and chest pressure. He attributed it to panic attacks and workplace anxiety, something his doctor had diagnosed him with 2 years prior. But a particularly bad episode led him to visit the ER. To his shock, the tests showed he had suffered a myocardial infarction. "It messed with my mind. I couldn't tell what was anxiety and what was real," Leo admitted. "Now I take every symptom seriously." Leo's story highlights the importance of not dismissing symptoms in younger individuals, especially when they have risk factors like family history, stress, or smoking. To understand how a silent heart attack occurs, we need to start with the heart itself, a powerful muscular organ about the size of your fist, tirelessly pumping blood throughout your body. Inside the heart are 4 chambers, the right and left atria, and the right and left ventricles. These chambers work together to receive oxygen-poor blood from the body, pump it to the lungs for oxygenation, and then send oxygen-rich blood back out to nourish every organ and tissue. This system works beautifully until something blocks the flow. Most heart attacks, silent or not, begin with coronary artery disease. Over time, plaque, a mixture of fat, cholesterol, calcium, and other substances, builds up inside the coronary arteries. This condition is called atherosclerosis, Imagine a garden hose. Now imagine that hose slowly getting clogged with sludge. Eventually, the flow of water weakens, or stops altogether. That's what happens in a heart attack. If a clot forms at the site of a plaque rupture, blood flow can be completely blocked. Without blood and oxygen, that part of the heart muscle begins to die. In a typical heart attack, people often feel intense pressure or pain in the chest. But in silent heart attacks, the pain may be minimal or entirely absent. Why? Because perception of pain varies. Some people, especially those with diabetes, may have damaged nerve endings or altered pain thresholds. Others may experience symptoms in unexpected ways, such as a sudden drop in energy, cold sweats, jaw pain, or unexplained nausea. Understanding this physiology is key to recognizing what your body might be trying to tell you, even in subtle whispers instead of shouts. One of the most intriguing and critical aspects of silent heart attacks is the question, why don't they hurt the same way? To answer that, we must explore how pain perception works in the human body. Pain isn't just a physical response, it's an interpretation by the brain. When tissues are injured, say, by a blocked coronary artery, specialized nerve endings called nociceptors send electrical signals through the spinal cord to the brain. The brain then interprets those signals as pain. However, this system is far from uniform. People with certain conditions, such as diabetes, can develop a type of nerve damage called peripheral neuropathy. This dampens the signals from the nerves, including those that detect pain. As a result, even serious injuries may not trigger the same alarm bells. Beyond diabetes, aging can reduce nerve sensitivity. So can certain medications, previous surgeries, or chronic stress. But even among otherwise healthy individuals, pain tolerance and awareness vary widely. Emotional state, expectations, cultural conditioning, and personal experience all shape how pain is perceived and reported. Some people may feel vague discomfort and ignore it. Others might notice fatigue or breathlessness without any chest pain at all. And then there are those who simply don't notice anything at all until it's too late. These nuances explain why many silent heart attacks go undetected until a routine EKG, stress test, or echocardiogram reveals the scar tissue left behind. Silent heart attacks don't announce themselves with blaring alarms, but the body does send signals if we know how to listen. The symptoms can be vague, fleeting, or mistaken for other common conditions. Yet, recognizing them early can be the difference between life and death. Here are some of the most frequently overlooked signs. Unusual fatigue, especially in women, unexplained and extreme tiredness can be an early sign. You may feel exhausted even after a full night's sleep. Mild chest discomfort, not necessarily pain, but a feeling of pressure, tightness, or fullness. It may come and go, and it's easy to ignore. Shortness of breath, if climbing stairs suddenly feels harder than usual, or you find yourself breathless without exertion, it's a red flag. A lightheadedness or dizziness, this could signal reduced blood flow to the brain due to a weakened heart. Indigestion or nausea, often mistaken for a stomach issue, this can especially be deceptive in silent heart attacks. Sweating without exertion, cold sweats or clammy skin when you're not doing anything physically intense can be a danger sign. Pain in unexpected areas, jaw, neck, shoulder, or arm pain, especially on the left side, can be referred pain from the heart. While none of these symptoms guarantee a heart attack, experiencing several together, or feeling that something just isn't right, warrants immediate attention. Who's most at risk? Understanding vulnerability to silent heart attacks. Silent heart attacks don't strike randomly, they tend to target individuals with specific risk profiles. Understanding who is most at risk can help guide early screening, prevention, and lifestyle adjustments that could be life-saving. Let's break down the major risk groups. 1. People with diabetes. Perhaps the most well-known group at risk for silent heart attacks. Diabetes, especially type 2, can damage nerves and dull pain signals, making it harder to recognize symptoms. Diabetic individuals are also more prone to developing atherosclerosis. 2. Older adults. With age comes a decrease in nerve sensitivity and changes in how the body responds to injury. Older individuals may attribute fatigue, breathlessness, or indigestion to aging, missing the true cause. 3. Women. Women are more likely than men to experience atypical heart attack symptoms, such as fatigue, nausea, and anxiety, rather than classic chest pain. This makes silent attacks particularly dangerous in women, especially postmenopausal women. 4. People with high blood pressure or high cholesterol. These two conditions silently damage the heart and blood vessels over time, setting the stage for heart attacks that go unnoticed until damage is done. 5. Smokers and former smokers. Tobacco damages blood vessels and accelerates the buildup of plaque in the arteries. Silent heart attacks are common in this group due to chronic cardiovascular strain. 6. Individuals with a family history of heart disease. Genetics can predispose people to heart attacks, even at younger ages and with fewer symptoms. If a close relative had heart disease, your risk is higher, regardless of lifestyle. 7. Sedentary individuals. Lack of exercise contributes to weight gain, metabolic issues, and weakened cardiovascular conditioning, all increasing the likelihood of both silent and classic heart attacks. 8. People under chronic stress. Stress raises cortisol levels, increases blood pressure, and can mask or mimic symptoms like shortness of breath and fatigue. Prolonged stress also affects heart rhythm and blood vessel function. 9. Those with previous heart problems. Anyone with a history of angina, previous heart attack, or known coronary artery disease is already vulnerable and might experience a silent one without the dramatic symptoms seen the first time. Knowing these risk categories can empower individuals to take proactive steps through lifestyle changes, medications, and regular checkups to prevent silent heart attacks or catch them early. How silent heart attacks are diagnosed. Diagnosing a heart attack without obvious symptoms presents a real challenge, even for experienced clinicians. Fortunately, medical science has developed several tools that can help detect these silent but dangerous events. Let's walk through the primary diagnostic strategies. 1. Electrocardiogram, EKG/ECG. One of the most common tools, an EKG measures the electrical activity of the heart. A silent heart attack may leave telltale signs like Q waves or ST segment abnormalities. However, some damage may go unnoticed if it's not acute or widespread. That's why serial EKGs or comparison with older tracings is often essential. 2. Blood tests for cardiac enzymes. When heart muscle is damaged, it releases specific proteins into the bloodstream. The most sensitive and specific of these is troponin. Even in the absence of major symptoms, elevated troponin levels can reveal that a silent infarction has occurred. 3. Echocardiogram, ultrasound of the heart. An echocardiogram can show areas of the heart wall that aren't moving normally, known as wall motion abnormalities. These often indicate past damage to heart muscle that may have occurred silently. 4. Cardiac stress testing. In this test, the heart is pushed to work harder, either through physical exercise or medication. If a portion of the heart isn't getting enough blood, the test may show reduced oxygenation or abnormal rhythms that suggest a past or impending heart attack. 5. Cardiac MRI or CT scans. Advanced imaging tools like cardiac MRI can detect areas of fibrosis, scarring, that form after a silent heart attack. CT coronary angiography can also identify narrowed arteries and vulnerable plaque buildup. 6. Routine check UPS that reveal clues. In many cases, a silent heart attack is discovered during a physical exam or routine testing done for another reason. An abnormal pulse, irregular rhythm, or unexplained fatigue may lead to further investigation. The consequences of a missed silent heart attack. One of the biggest dangers of a silent heart attack is just that, it's silent. When left untreated or undetected, the aftermath can be serious, even deadly. Let's explore what can happen if a silent heart attack goes unnoticed. 1. Permanent damage to heart muscle. Heart tissue that doesn't get oxygen during a heart attack begins to die within minutes. The longer the delay in treatment, the greater the damage. Even if the event goes unnoticed, the scar tissue left behind can permanently affect how the heart pumps blood. 2. Increased risk of future heart attacks. Having one heart attack, silent or not, means you're more likely to have another. And the next one may not be silent. Without addressing underlying risk factors, the odds of a more severe or fatal attack rise significantly. 3. Development of heart failure. Damaged heart muscle can weaken the organ's ability to pump effectively, leading to heart failure. This condition causes fatigue, shortness of breath, and swelling in the legs or abdomen, and can severely impact quality of life. 4. Risk of arrhythmias, abnormal heart rhythms. Scarred heart tissue can disrupt the electrical signals that control your heartbeat. This increases the risk of arrhythmias, which can cause fainting, palpitations, or sudden cardiac arrest. 5. Misdiagnosed or mismanaged symptoms. Because silent heart attacks don't cause dramatic symptoms, future complaints like fatigue or breathlessness may be dismissed or attributed to anxiety, aging, or other benign causes, when in fact they're signs of worsening heart function. 6. Emotional and psychological toll. Once diagnosed, often long after the event, patients may feel fear, guilt, or shock. Many wonder how they missed it and worry constantly about their heart. Anxiety and depression are common. Case study: from silent to serious. Angela, a 63-year-old retired teacher, never imagined she'd had a heart attack. She noticed she couldn't walk as far as she used to and occasionally woke up breathless, but assumed it was due to weight gain or lack of exercise. When she finally visited her doctor, an echocardiogram revealed she had significant heart muscle damage from a silent MI months earlier. It made sense afterward. I just didn't know the signs, Angela reflected. If I'd gone in sooner, maybe the damage wouldn't be this bad. How to respond after a missed silent heart attack. If you, or a loved one, find out that a silent heart attack occurred in the past, it's not too late to take action. Here's what should happen next. Get a full cardiovascular workup with a cardiologist. Begin or adjust medications to reduce the risk of another heart attack, e.g., aspirin, beta blockers, statins. Make lifestyle changes. Quit smoking, eat heart healthy, exercise regularly, and manage stress. Track your symptoms closely and attend regular follow-ups. Get emotional support if you're struggling to process the news. Counseling or a support group can help. In the next chapter, we'll talk about prevention, how you can reduce your risk of ever having a silent heart attack in the first place, and the role early screening plays in saving lives. Prevention and early screening, taking control before it's too late. The best way to deal with a silent heart attack is to never have one at all. Prevention is your most powerful tool, and it starts with awareness, action, and the willingness to make healthy choices today. Let's explore the top prevention strategies. 1. Eat for heart health. Your diet fuels your body, including your heart. Prioritize whole grains like oats, brown rice, and quinoa, leafy greens and colorful vegetables, healthy fats like olive oil, avocados, and nuts, a lean protein such as fish, chicken, and legumes. Reduce or eliminate processed foods high in sodium, sugar, and trans fats, red and processed meats, sugary beverages, and snacks. 2. Move your body regularly. Physical activity strengthens the heart and improves circulation. Aim for at least 150 minutes of moderate exercise per week. Activities like brisk walking, cycling, swimming, or dancing. Resistance training twice a week for muscle and metabolic health. Even short walks after meals or light stretches throughout the day can make a difference. 3. Monitor blood pressure, cholesterol, and blood sugar. Silent killers like high blood pressure, high LDL cholesterol, and elevated blood glucose often go undetected, just like silent heart attacks. Get screened regularly, especially if you're over 40 or have risk factors. Follow your healthcare provider's advice for medication or lifestyle adjustments. 4. Quit smoking and limit alcohol. Smoking is one of the most direct contributors to heart disease. Quitting can reduce your risk significantly, no matter how long you've smoked. Alcohol in excess also raises blood pressure and cholesterol levels. 5. Manage stress proactively. Chronic stress elevates cortisol, increases blood pressure, and can lead to unhealthy behaviors. Stress management strategies include meditation or mindfulness, deep breathing exercises, journaling or talk therapy, spending time in nature or with loved ones. 6. Maintain a healthy weight. Obesity is a major contributor to cardiovascular disease. Set realistic, sustainable goals for weight loss and maintenance through balanced nutrition and movement. 7. Get adequate sleep. Poor sleep increases your risk for hypertension, diabetes, and inflammation, all of which contribute to heart disease. Aim for 7 to 9 hours of quality sleep per night. 8. Attend regular check UPS and screenings. Silent heart attacks often show up during routine tests. Don't skip them. Key screenings include EKG or stress test if at high risk, lipid panel, cholesterol, HbA1c or fasting glucose for diabetes, blood pressure readings. 9. Know your family history. If cardiovascular disease runs in your family, start preventive care early. Your doctor may recommend additional testing or earlier interventions. 10. Follow medical advice and take prescribed medications. If your doctor has prescribed statins, blood pressure medications, or aspirin therapy, follow through. Sticking to your medication plan dramatically reduces your risk. Case study: prevention that paid off. Daniel, 49, had a family history of heart attacks and type 2 diabetes. Though he felt healthy, his doctor suggested a routine EKG and blood panel at his annual checkup. The tests revealed high cholesterol and prediabetes. With guidance, Daniel adopted a Mediterranean-style diet, began walking daily, and lost 18 pounds over 6 months. A follow-up showed improved numbers and normal heart rhythm. I caught it early. That checkup probably saved my life, Daniel shared. Responding to a silent heart attack, what to do right now. When the signs are subtle or mistaken for something else, it's easy to hesitate. But time is muscle, even in a silent heart attack. Every minute counts. Here's how to respond if you or someone else may be having a silent heart attack. 1. Pay attention to the clues. Even vague symptoms should not be ignored if they are new, persistent, or unusual for you. Think: unexplained fatigue or shortness of breath, chest discomfort, light pressure, or burning sensation, dizziness or nausea without a clear cause, cold sweat or unexplained anxiety. If you're experiencing multiple symptoms, or if they linger more than a few minutes, assume the worst and act fast. 2. Call emergency services immediately. Don't wait for symptoms to go away. Call emergency medical services, like 911 in the U.S., and describe your symptoms clearly. Paramedics can begin treatment on the way and alert the hospital to prepare. 3. Don't drive yourself. If you're alone, call an ambulance. Driving yourself can be dangerous if symptoms worsen suddenly or if you lose consciousness. Let the professionals take over. 4. Take an aspirin if instructed. If you're not allergic and have no bleeding risks, chew a standard 325 milligrams aspirin while waiting for help. It can help reduce blood clotting and limit heart damage, but only take it if advised by emergency personnel or your healthcare provider. 5. Stay calm and rest. Sit or lie down and stay calm while waiting for help. Avoid physical activity. Take deep, slow breaths and try to stay mentally composed. 6. Inform someone you trust. If you're able, let a friend or family member know what's happening. They can meet you at the hospital or help communicate with healthcare staff. For caregivers, what to do if you suspect a loved one is having a silent heart attack. Ask questions. How long have you felt this way? Does the discomfort get worse with activity? Observe carefully. Look for pale or clammy skin, labored breathing, or signs of distress. Don't dismiss complaints. Even if the person is unsure or minimizing their symptoms, stay alert. Call for help. Better safe than sorry. Silent symptoms don't mean harmless outcomes. Case study: a quick response saved Paul's life. Paul, 55, was relaxing at home when he felt a wave of nausea and tightness in his jaw. He almost ignored it, thinking it was something he ate. But his daughter remembered hearing about silent heart attacks and insisted on calling emergency services. At the hospital, doctors confirmed a heart attack had occurred and that rapid response prevented serious damage. I owe her my life, Paul later said. It didn't feel like a heart attack, but it was. Final takeaways and becoming a heart health advocate. Silent heart attacks remind us that danger doesn't always come with flashing lights. Sometimes, the most serious threats are the quietest. But with knowledge, vigilance, and proactive care, we can dramatically reduce the risk and help others do the same. Let's wrap up with a few final takeaways. 1. Listen to your body, even the whispers. Pay attention to anything that feels off, whether it's fatigue, dizziness, indigestion, or anxiety. These may be small signals of a bigger issue. 2. Know the risk factors. Diabetes, age, high blood pressure, cholesterol, smoking, stress, and family history all increase your chances. The more risk factors you have, the more vigilant you need to be. 3. Stay consistent with screening. Routine checkups, blood tests, and cardiac screenings save lives. Make them part of your yearly health calendar, especially after age 40. 4. Make heart healthy, living a daily habit. Exercise. Eat well. Sleep enough. Reduce stress. These aren't one-time events. They're lifelong practices that protect your heart. 5. Educate others. Share what you've learned with friends, family, and coworkers. Most people don't know about silent heart attacks. You could be the reason someone catches one early or prevents it altogether. 6. Advocate for awareness. Encourage local clinics, schools, workplaces, and media platforms to raise awareness. Community education saves lives. 7. Don't wait for the big symptoms. If you're worried, get checked. Don't brush off small signs just because they're not dramatic. Early action is the most powerful intervention. Thank you for joining me on this essential journey into the world of silent heart attacks. Whether you listened out of curiosity, concern, or personal experience, I hope you walk away empowered with not just knowledge, but the drive to act on it. Remember, silence doesn't mean safety. And prevention doesn't have to be perfect. It just has to start today. This has been Health Talk 366. I'm your host, and I'll see you in the next episode. Until then, take care of your heart. It's the only one you've got.